For seniors, having strong legs is the key to maintaining your mobility and function as you age. Ask yourself these questions. Do you feel like your legs are becoming weaker? Do you need to hang onto the rail when you walk up the stairs? Do you find yourself wanting to touch objects in your home when you're walking, such as your sofa, countertop, or wall? The good news is there is a way to fix this. In this video, I'll show you the key to improving your leg strength so that you can have less pain and become more independent regardless of your age. As many of you know, leg strength is directly linked to longevity. It is crucial for maintaining mobility and balance. One of the biggest challenges seniors have is getting the ball rolling and getting started. The beginning can sort of feel like an uphill battle. The truth is that it doesn't have to feel like this. If you have arthritis, joint replacements, or other orthopedic issues, don't worry. This progression can still help you. Of course, make sure your doctor has cleared you for exercise, especially if you have recently suffered an injury or had surgery. Difficulty getting started is the exact reason at our physical therapy clinic, we only give patients the amount of homework that we know the patient will do. Some people can handle 15 minutes a day of exercise, while others maybe only 5. Just make sure to try to do it every day. Make it part of your routine. But if you need to take a day off here or there, that is fine. We've seen this approach work time and time again in our physical therapy clinics. It even worked with my 91-year-old grandma with her homework. One very important concept that I want you to understand is the importance of the neuromuscular component of strength. Just because you have muscle mass doesn't necessarily mean it equates to good strength. The timing of your muscle contractions and the force they can produce relies on the signal that your nerves carry from your brain. Since there are always many muscles working together at all times, this is a very complex system. It is also a system that weakens the less you challenge it. The fancy medical term we'll give this is neural adaptation. What this means for you is that strength training doesn't have to be aimed at building muscle, but can instead be focused on coordination and the quality of movement, at least in the beginning. And you don't have to bulk up like a bodybuilder. I'm going to give you 5 exercises starting from easiest and becoming a little bit more difficult as we go. You don't need to do them all. Just work your way through them and figure out the appropriate starting point and go from there. I want you to start off with the one that is a little bit challenging, but not hard. The first exercise to start, I'll call standing knee extension. Technically terminal knee extension because it's focusing on that last little bit of your knee extension and the part of your muscles in your thighs that do that. I have a simple playground ball that you can pick up from any sporting goods store or off Amazon. But if you don't have a playground ball, you could also use a rolled up towel and that'll work just as well. So you're going to take the ball, you're going to put it behind your knee, right in the crux of your knee. You want to keep your heel on the ground back towards the wall and also take your hips and place them back against the wall. Stagger your stance a little bit and get the other foot out in front of you just so you're a little bit more stable. Now, the whole thing is going to be to compress that ball by using your thigh and try and straighten out your knee. I don't want you to go up on your toes when you do this. I want you to keep some weight through your heels, and it's actually okay if your toe or the ball of your foot lifts up. But we're going to squeeze nice and slow. Hold it for about 3 seconds and then let it off slow over a couple seconds. So ramp up a couple seconds to get a full squeeze. Hold that squeeze for 3 seconds. Ramp down by letting it go slow. Remember, we're working on the neuromuscular control. So it's not about how hard we can press. It's about how hard we can press by doing it nice and smooth and controlled. So 2 seconds on. 3 second hold, and 2 seconds off, super smooth. Repeat that until either your thigh gets really tired or you reach 10 repetitions. The next exercise I'm going to show you are called straight leg raises. They're going to start off doing kind of like we did in the last exercise, setting the quad or straightening the leg by tightening your thigh here. You're going to squeeze it nice and tight, lock it in like a board. Keep it locked in, keep your stomach tight so your back doesn't arch, and pick it up off of the table about 45 degrees. Make sure you keep your other leg at about 45 degrees too. Not only is that better for your back, but it also gives you a target so you can raise up to about the same height as your other leg, lower it down nice and slow. At the bottom, I like to relax and start over again. Since we're working on that neuromuscular control, keeping your thigh tight the whole time and just doing touch and go isn't going to challenge our neuromuscular control as much as it would if you had to turn it off and turn it back on. So tighten up, do that quad set, pick it up, level with your other leg, 45 degrees, lower it down nice and slow, heel touches, relax. What you'll notice is that as I pick up my leg, I don't want my knee to bend at all. So I'll show you kind of the wrong way to do it so you can see what it looks like. But depending on how strong your legs are, you might have a little bit of quad lag, as we call it, where you tighten up. And as you're picking up, that knee will break and bend. Sometimes it happens on the way down as well. So again, we want to focus on the quality of this motion, not how fast we're going or the quantity yet. So tighten up. I'll show you one more time. Pick it up, lower it down, keeping that leg locked in the whole time, and relax. Start off with 10 repetitions, doing it perfectly. If you can get that, then maybe go up to a set of 10 after that, making it 2 sets. The other thing you can do if you have them is add a pound or 2 of an ankle weight to your ankle and make it a little bit more challenging. Once you do the ankle weight, if you have it and it's too easy, then you're going to move on to the next exercise. Next, I'm going to show you an exercise called bridges. This exercise is going to work your glutes and your hamstrings, and it's also going to work your core a little bit as a bonus. You want to start off in the position with both legs bent. You want to tighten your core, keep your body just like a plank, push through your heels and your feet into the table or the bed, lift up as high as you can without arching your back, okay? So as high as you can without arching, hold it for 2 to 3 seconds, and then let it down nice and slow. The biggest issue I see people do is arch their back. They want to get that extra little bit of range of motion and get a little bit higher, and then that's where they tweak their back or injure their hip. So make sure you keep your stomach nice and tight, push through your heels, lift your butt up, squeeze those glutes, hold, and let it down nice and slow. Quality here. So you want to feel the muscles contract. You want to feel them really squeeze throughout the exercise, squeeze at the top, and then control it back down. We're trying to build that neuromuscular control here. So as soon as you get that pattern down and it's easy and tolerable, one way to transition or progress this is by adding a little weight. So I have a 10-pound dumbbell here. Find an object around your home that weighs about 10 pounds if you don't have dumbbells. Place it right on the hips, right across the hip bones, and hold it nice and firm with your hands. And then you're going to do the same exercise, pushing through, and it's just going to be adding a little bit of resistance throughout the exercise, a little bit of weight. You want to do this for the same count, about 10 to 12 reps, or until you start to feel fatigue. Take a little break, progress yourself to 2 sets. The next exercise we have are sit-to-stands. Now, this one is important. It hits all the muscles in your legs, very functional. And there's a couple ways to either make it easier or make it harder. So it's ends up being a great exercise for seniors no matter what your strength level is. In order to make it easier, you would just throw a pillow or a folded up towel on the seat of your chair to raise your butt up a little bit. That'll make it easier. Set yourself up in a chair. You want to scoot off the back a little bit, and you want to get your feet shoulder width apart, feet and knees shoulder width apart. Walk your heels back and keep your back straight while you hinge forward and stand. So chest comes over your heels, you push up, stand up. As you sit down, your chest comes over your heels, your butt goes back, and you sit down all the way. Now, it's about control. We're working on that neuromuscular control. So think about being kind of faster on the way up and slower and controlled on the way down. Once that becomes doable, where you do 10 reps or so without hitting high fatigue, now it's time to make it a little bit harder. Couple ways you can do this. First, take a weight, hold it in your hands, and stand up that way, okay? That's a pretty simple progression to make it a little bit more challenging. The next thing you can do is bring a little bit more hip muscles into it, specifically your abductors on the side of your hips, by putting the band around your feet and then stretching it up around your knees. Okay, now what you want to think about doing is, as you're standing, drive your knees apart. Don't let the band win the battle and pull your knees together. So I'm going to sit to stand. I'm thinking about pushing out the whole time. Lean forward, push, stand, sit down, push apart, nice and controlled. I'm going to do that one more time. Knees go out, stand up, knees go out, sit down. I felt that a little bit more in my hips. It's going to tie everything in nicely. The last exercise I'm going to show you today are called split squats. You're going to have something to hold on to. It could be your countertop, it could be a chair like I have, and you're going to stagger your stance. Feet are actually about shoulder width apart, but one foot's in front of the other, and you're going to get pretty wide, okay? Because what we do is we want the knee to stay inside of the toe as you go down. You don't want to necessarily the knee to go too far over your toe. That could cause pain for some people, so let's just avoid that. So body's upright, back foot behind you, front foot nice and wide. You're going to go down until you feel like it's challenging, and you're going to go back up. Some people will be able to go a little further than others. Wherever that perfect spot is, that Goldilocks position where it's just right, I want you to hold that one. Go down, come back up. You should feel the weight going through your heel on the front foot and your toe on the back foot. Remember, this is about quality, not quantity, and you really want to exaggerate the contraction of your thighs at the top. So I'm going down, pushing, and then squeezing both thighs. Releasing as I go down and squeezing both thighs. Do this to fatigue or 10 reps, whichever comes first, and then switch legs. Nice and far apart, feet wide, weight through the front heel and the back toe, go straight down and squeeze at the top. Straight down, squeeze at the top. Same count, 10 reps or fatigue, whichever comes first. Now, I made a point to focus on the quality of the movement. I want to stress that good quality doesn't always mean slow. This is something that a lot of physical therapists get wrong. Everything they have their patients do in the name of quality is slow. The better trained you become and the better your neuromuscular control, you'll want to start picking up the speed of your movement, making sure to maintain the quality. If you start to feel like you're getting out of control, then dial it back. However, building your power, which is the amount of force you can generate in a set amount of time, is very functional and will definitely make you stronger. So any of the exercises we did in this video, as you start to build confidence, speed them up a little bit. Be controlled when you need to, but work on that speed. We hope that you found this information helpful. If you did, please make sure to like this video and subscribe to our channel so that you'll see each time we launch new content. We love getting you free content each week, but in order to do this, we rely on your support. Thank you for tuning in. Until next time.